Type 2 diabetes, this is a group of metabolic disorders leading to elevated blood glucose levels due to insulin resistant and impaired insulin secretion. When we talk about insulin resistant, we are trying to mean that there is decreased tissue sensitivity to insulin. And when we are actually talking about impaired insulin secretion, we are trying to mean that there is a decline in beta cells secretory rate or decrease in beta cell mass. For example, the beta cell size and number or both. So, pathophysiology of type 2 diabetes. When we're actually talking about pathophysiology here, we're actually going to focus on insulin because all the problem that has actually come here has actually been resulted due to the issue with insulin. So the two main problems related to insulin type 2 diabetes are insulin resistant and impaired insulin secretion, resulting to raised blood sugar levels. Insulin resistant refers to a decreased tissue sensitivity to insulin. Normally, insulin binds to special receptors on cell surfaces and initiates a series of reactions involved in glucose metabolism. In type 2 diabetes, these intracellular reactions are diminished, making insulin less effective at stimulating glucose uptake by the tissues and regulating glucose release by the liver. The exact mechanism that led to insulin resistance and impaired insulin secretion in type 2 diabetes are unknown, although genetic factors are thought to play the biggest role. So to overcome insulin resistance and to prevent the build-up of glucose in the blood, increased amount of insulin must be secreted to maintain glucose level at a normal or a slightly elevated level. Insulin resistance may also lead to metabolic syndrome, which is a constellation of symptoms including hypertension, hypercholesterolemia, abdominal obesity, and other abnormalities. So, despite the impaired insulin secretion that is characteristic of type 2 diabetes, there is enough insulin present to prevent the breakdown of fat and the accompanying production of ketone bodies. Therefore, DKA does not typically occur in type 2 diabetes. However, uncontrolled type 2 diabetes may lead to another acute problem, which is called hyperglycemic hyperosmolar syndrome. We normally call it HHS. So let's look on the signs and symptoms of type 2 diabetes. So because type 2 diabetes is associated with a slow, progressive glucose intolerance, its onset may go undetected for many years. And that is actually the reason why type 2 diabetes cannot be diagnosed at a younger age, like below 20 years of age. So if the patient experiences symptoms, they are frequently mild and may include fatigue, irritability, polyuria, polydipsia, poorly healing skin wounds, vaginal infections, or blood visions if glucose levels are very high.